we all are gathered here virtually to attend the webinar on contemplating eating disorder and body diversity among adolescents. Talking about eating disorder, as we all know that eating disorders are a complex mental illness which is caused by an interplay of genetic as well as environmental factors. Body diversity, especially a negative body image, can be a potential contributor to the eating disorder. So, to enlighten us all regarding this topic, today we have with us Miss Nitu Badoria, Madam.
Hello, everyone.
Talking, hello, Madam. Talking about Neetu Madam's academic profile, Madam has completed her MSc Nursing in Psychiatric Nursing from College of Nursing Sciences and Research in year 2010. Madam has also attained post-graduation diploma in hospital administration from Gotham Institute of Health Administration, Bangalore. Sharing Madam's research credential, Madam has published several papers in national and international journals. Madam has also presented research papers in various international conferences. Madam has been a reviewer of various journals, and Madam is also serving as a member of editorial board from UGINR International Journal and KSCON International Journal. Madam has a total of more than 15 years of experience in academics. Madam, it is indeed our pleasure to have you with us, and on behalf of our university, I would like to welcome you.
Thank you, ma'am.
I would also request you, ma'am, to take the lead and start the session.
Okay. So, hello, everyone. As ma'am have given a so nice introduction of mine, in spite of that, I just want to be convey a thing that I am like that you people are. And when we are conversating regarding the eating disorders, so some things that comes in our mind are some images, or we can say regarding the eating disorders, we are having so many things in our mind. Some images are there, some questions comes in our mind. So today I will like to be solve out all the your questions or your worries from my side. And if in between you people are having any doubts or worries, you can give these queries to ma'am, and I think she will be taking care of that. So today the topic for discussion that we are having is the contemplating eating disorders and body diversity among the adults. Eating disorders are having the impact on all ages, but when we are significantly looking for the most prevailing age factors than in adults, it's quite more in comparison to the adult age, another ages in childhood. Nowadays, recent researches have been shown that after elders in adulthood also, that is in 40s or 50s, especially females are also suffering from eating disorders. So nowadays, it's not a disease or it's not a mental illness of the adults also, but for the increased aging factor also, we are having some things. So today in our lecture, we will discuss regarding some statistics of eating disorders, presently the data that we are having regarding them. We will have a small discussion on the definition, the types of eating disorders, 2 or 3 types I have taken on more priority. Then some warning signs. The warning signs will include that being as in mental health worker, being as in health professional. What are the things that we have to be noticed out in our patients or in our surroundings that that particular person is suffering from eating disorder? Because when we are talking regarding the eating disorders, no one is taking that thing in a positive way. No one will agree, yes, I am suffering from a eating disorder. They will always deny. So we have to be check out these warning signs, and on the basis of these warning signs, we have to be get some diagnosis. Then prevalence of eating disorders in adults. How much percentage of eating disorders in which particular age, or what are the contributing factors that leads to eating disorders? That also a part of our discussion. Then factors provoke adults. There are the certain stressors or factors which we can say, and these are playing a leading roles to adopt the malpractices that adults are having nowadays. Then definitely our media is also playing a role in increasing the incidence of eating disorders. That perspective also we are going to be discussed in a bit. Then the treatment strategies. that can we have inpatient as well as outpatient treatment strategies we will discuss in today's lecture. So let's start the journey. Firstly, we will have a discussion regarding some stats or some data. The major fact that I want to be discuss with you people that when we are talking regarding the average woman, so the figure that comes in our mind is the average height is 5 to 4, 5.4 or 5.5, and the weight is 140 pounds. That is the average woman according to our Indian traditional. But when we are talking regarding the models or supermodels, then that height is quite bit increased. It reaches up to 5.11, and weights it decreased, that is the 117 pounds. So see the big difference in the weight when the height is increasing. Along with that, also for being as a supermodel, or according to our Indian discriminations, we are taking the thin people as more beautiful. So here we are having 117 pounds. To achieve that particular body mass or body weight, the adults and especially the females are having the more privilege in the eating disorders. They are struggling very hard. They are dieting, they are omitting the foods, they are taking the medicines, they are taking the laxatives, and these ill practices will lead to a number of eating disorders. Definitely, when anyone is doing such practices for a large number of days or for a couple of days, then they will be leads to body depletion of certain electrolytes, and they can have certain body problems also. And so that is the major perspective that we are going to be discuss. Our over one half of teenager girls, when we are talking about, these
Madam,
are having the incidence of weight
madam,
control behavior. They are skipping the meals. They are smoking. The
excuse me.
fasting is also a practice. Yes, ma'am.
I'm sorry to interrupt you, but your slide is not visible, ma'am. Can you please reshare your slide?
Just a minute. Just a minute. Is it visible now? Ma'am, is the slide is visible?
Yes, madam. Now it is visible. Now we can see it clearly.
So we are on the statistics. I'm starting the thing again. Our one half of teenage girls and especially the one third of teenage boys are using the unhealthy weight control practices and behaviors. They are just skipping their meals. They go for smoking. They are fasting, and sometimes they are usually going for vomiting, or they are taking the laxatives, or they are taking sometimes that diuretics also to reduce their weight. 42% of one-third grade girls wants to be thinner. That is the average criteria for Indian population. If we can have, then 81% of 10-year-olds are afraid of being fat. See the age factor here. The 10-year-olds are also being afraid of that. Why? Because they want to achieve that supermodel figure. If we're talking regarding the eating disorders, that is a sort of a mental disorder defined by a abnormal eating behavior. When anyone is having an abnormal eating behavior, that negatively affects their personal, physical as well as mental health, then that is categorized as an eating disorder. Firstly, we will discuss regarding the anorexia nervosa. As we are seeing in the picture, so a little bit comes in our mind that a girl is standing there and she is seeing herself as a fat body personality, in spite of the thing that she's not does. And in second one, the portion cut. That is also a practice that is followed by the adults. They are cutting their portion of meals. They are taking very less amount of meals. They are cutting it off, and definitely it will be leads to so much physical distress on them. Uh, Mainly, that anorexia nervosa is characterized by excessive weight loss. Uh, the adults are having excessive weight loss in small duration. Then self-starvation, they're ignoring their hunger, they're ignoring their need of food. Sometimes they are having so much anxiety about weight gain. Even though when they are eating two chapatis, then they are calculating the calories. Oh, after eating these two chapatis, I am going to have that much weight gain. That is the excessive anxiety that these people are having. Then they are denial their hunger, they're not accepting the fact of their hunger. Then constantly excuses to avoid the meal times. We all know that we must have a breakfast, lunch, and dinner. So they're avoiding their meal times because of the excuses. For example, they are saying, "I am busy in a work. I have to be do another work. I will take my breakfast on the way." And especially the girls, they are taking such type of excuses and they are avoiding their meal times. Then excessive rigid exercise regimen, if they have eaten the food, after that what they are doing, they are following the rigid exercise regimen, they are working too hard to burn off their calories. Then usually they withdraw from their social friends. Resistance to maintain body weight or above a minimum normal weight for age and height. Intense fear of weight gain. As I told you earlier, also, these people are having intense fear and anxiety that they will gain the weight. So, or they will look fat. They don't fit in their dresses. So, because of these intense fear and anxiety, they does these such type of malpractices, even though underweight. Yes, that is a fact that I want to be focused here. Even though these people or these adults are underweight, after being of underweight also, still they are starving themselves to lose the weight. Why? Because they want to be fit in that criteria. Disturbances in experience of body weight or shape on self-evaluation. They are always doing their self-evaluation. They are spending more time in front of the mirrors. Then loss of menstrual periods for the females, that is a common indication that when they're not getting their proper nutrition, their menstrual periods are going to be lost, or there is a disturbances in the menstrual periods. What being as a counselor you have to be looked for. As I told you that that is a sort of a mental illness that no one is accepting it. In spite of being a patient of eating disorders, they're not accepting the fact, yes, we are suffering from that particular disease. Then what we have to be do, we have to be look for certain signs that are presented in them, and then we have to be go for the diagnosis. So being as a counselor, we have to be focused on rapid loss of weight. If your patient or if your colleague or in your community, if someone is having rapid loss of weight in small duration, then changing eating habits if someone is skipping the meals, withdrawing from a friend or social gatherings, if someone is having hair loss or dry skin. Definitely, if someone is not getting the proper nutritional diet and balanced diet, that starvation will lead to certain physical problems in them, and hair loss and dry skin is one amongst them. Then extreme concern about appearance or dieting. They will be have extreme concern about their figure, how they are looking, how they are showing, and they are having preoccupational thoughts of dieting. Always they are preoccupied with the ideas of dieting, what we will have in our meals, how we can cut our meals. That is the things that they are talking about most prominently. Then the most common age range for the anorexia is, in most cases, the women's ranging in age from early teens to mid 20s. That is from 13 to 25 years of the age is the most common age for the eating disorders if we are talking regarding the females. Recently, there have been some cases of women and men in 30s and 40s also who are suffering from eating disorders. And again, that is also the impact of media, that everyone wants to be look very beautiful and they are comparing the beauty with the body regimen. Then the 40% of newly identified cases are in girls between 15 to 19 years, and there is a significant increase in the women aged 15 to 24 years in the recent years. Okay, so that is all regarding the anorexia nervosa. The second thing, that comes is the bulimia nervosa. In bulimia nervosa, just opposite to anorexia. In anorexia, what is happening? Someone is not taking the food properly. They are cutting out their meals and their portions of diet. But in bulimia nervosa, the aim is the same. They want to be look. They want to look slim and trim. They want to be maintain their beauty in terms of their weight loss. But what they are doing, they are eating bingely. They are taking the large portions of food, and after taking these portions, what they are doing, they will go for vomiting. They will go for purging. They will go for extreme exercises after taking the large amounts of food. And definitely that overeating, and after overeating, getting rid of that food will leads to so much physical problems as well as mental distress on these people. Recurrent episodes of binge eating is very common in the females. An episode of binge eating is characterized by the following ways. We can have following characteristics as an episode of binge eating, which are shown here. Eating in a discrete period of time within any 2 hours period. Okay. I will not say that we will have to be have very frequent eater. We just have to be stick on our meal regimen. Most probably we can have 3 main meals and then 2 short meals or 2 snack meals. But what these people are doing, they are eating after every 2 hours, and they're eating in a large amount. That is definitely larger than most people would eat. Their portions are their meal is much larger, definitely, than the normal people within a smaller period of time and under similar circumstances. A sense of lack of control, overeating during the episodes. These are having the sense of lack of control. They are not able to be control on their eating habits. They want to eat more. They are attracted towards the food. They want to eat a lot of chocolates, lot of ice creams, and because they don't want to weight the gain, what they are opting out, they are just going for purging. Then feeling that one cannot stop eating or control what or how much one is eating. Here we are having a diagram. I think so that is able to be provide you a clear view regarding the bulimia nervosa. Here, as I told you, that binge eating is there, eating in the large amount and in between of a small duration. Then they are having self-induced vomitings. Again, they will go for binge eating, and again they will go for self-induced vomiting. So this will be goes on like a circle. They will be eating the food, and in between of the eating of food, because they won't want to be gain the calories and weight, what they are going for? They are going for vomiting. Sometimes they are using the laxatives also. They are going for emptying out their stomach time to time. These are the general views that we are seeing in the patients of bulimia nervosa. Recurrent inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting. The common behavior that we will see in the patients of bulimia nervosa is the self-induced vomiting. Misuse of laxatives. They are using the laxatives without the prescription. That is the misuse of laxatives. Then they are using diuretics also. They are using enemas or another sort of medications. Sometimes they will go for fasting. For example, if someone have a binge eating for a day, then after eating they feel guilty or they will be feel anxious. Yes, I will gain the weight. So what they are doing, then they will go for the fasting, or they will be go for excessive workout, which is not very beneficial for our physical health. The binge eating and inappropriate compensatory behavior both occurs on average at least twice a week for 3 months. So when we will consider that patient as a patient of bulimia nervosa, when anyone who is having that bulimia, that episode of binge eating and using of that purging in form of vomitings or laxatives or enemas for at least twice a week, or that will be continued for 3 months, then only we will consider the patient as a patient of bulimia nervosa. Self-evaluation is unduly influenced by body shape and weight. The disturbances does not occur exclusively during episodes of anorexia nervosa. Some of the common symptoms of bulimia nervosa I have tried to be chalked out. The first one is eating a significant amount of food in a limited time. As I told you that these patients are not having the control on their eating habits. So what they are doing, they are eating a large amount of food in a limited time, as we are seeing in that picture. Then after eating that large portion of food or large amount of food, what they are feeling guilt, or they are feeling shame. They are anxious after eating. Now that food will leads to weight gain in us. Then they are always preoccupied with body weight and shape. As I told you earlier, also these patients of eating disorders, either it's anorexia or either it is bulimia, they will spend a number of hours in front of a mirror. Why? Because they are preoccupied with the body weight and shape, and they are always going for evaluating themselves. Then purging food from the body after eating. Now they are using the purging methods, either in the form of a vomiting or either in the form of a laxative or enemas. They want to get rid of that food. That is why they are using these purging practices. Sometimes they are using diet pills or diuretics to control the weight also. And the last option or the common symptom that we are seeing in the patients of bulimia nervosa, that is the excessive exercise. Okay, the basic difference, other signs and symptoms are somewhat common in between of anorexia and bulimia, but the basic difference is that in anorexia nervosa, the patients are cutting off their meals, and in bulimia nervosa, they are eating bingely. Common symptoms. These are the common symptoms of eating disorders that we are having on our screen. Eating large amount of foods, that is uncontrollably. Then they are going for the vomiting, for using the laxatives or using other methods to eliminate the food like purging. Then they are having very concerned, always these patients are very concerned about their body weight. And because of that over concern and anxiety, sometimes it will lead to very hectic psychiatric problems as depression and other anxiety disorders in them. So they are having very frequent fluctuations in their mood. They're having mood swings because of that. Unusual dental problems are also a part, because when someone is excessively vomiting, and that is the self-induced vomiting. So because of the gastric juices, these which are coming with the vomiting, that will be leads to so much dental problems and dental caries in these patients. Then they are having swollen cheeks or glands. That is also a sign and symptom that is very probably seen in the patients of these bulimia nervosa patients. They are always having swollen cheeks and glands because of that practice of vomiting. They are having heartburn, they are having bloating, and they are sometimes having swelling of the stomach also. Warning signs. In case of bulimia nervosa, what warning signs, being as a counselor, you have to be lookout. I have listed the evidence of binge eating, evidence of purging, and excessive behavior, rigid exercises regimen. These are the few things that are very common in these patients. And being as a counselor, you have to be look in your patients. Then unusual swelling in the cheeks and jaw area, as I told you earlier also. Cellulose on the back of the hands and knuckles from self-induced vomiting. Discoloration and staining of teeth, as I told you that it will lead to so much dental problems also. Creation of lifestyle schedule and rituals to make them time for binge and purging sessions. Withdrawal from friends in activities. They are just avoiding their friends and they're avoiding the activities because they don't want to be waste their time there. In journal, behavior and attitude indicated that weight loss, dieting, and control of food are become primary concern. So each one of us are having some primary concerns in our life. For those patients who are suffering from that eating disorders, for them the primary concern is the weight loss, the dieting, the pills that they can have. They either they are in a social gathering, either they are in a meetings, either they are in their peer group, either they are surfing their phones. They are always having a look on such type of practices by eating which particular medicine I can have weight loss, which are the particular foods which can lead to weight loss. Like that, they are always concerned with the such type of things. So that is how that their whole life will revolve around that particular thing. Prevalence of eating disorders in adults. Now, that is a general discussion that we are having regarding the eating disorders. Now, we will see how these are very prevalent in the adults. That is the basic concept that we are having of today's webinar also. The average onset of bulimia begins in late adolescent or early adult life. It usually begins in between of 16 to 21, and some of the women are also having it after the 30s. The prevalence of bulimia nervosa among adults and young adult females is approximately 1 to 3%, and the rate of occurrence in males is approximately 1/10 than in the females. So we can conclude that females are the major community that are suffering from eating disorders in comparison to the males. The males are also having it, but the prevalence rate is quite high in females. Health consequences. So let us focus there. After having that malpractices, that ill practices, after having that disturbed regimen of eating, after skipping the meals or overeating and then go for purging, how does it affect us? It affects us in both the ways. It affects us physically as well as mentally. So, first of all, we will discuss the physical health consequences that one can have after the eating disorders. These are the causes electrolyte imbalances that leads to irregular heartbeats and possibly heart failure to death. See how much complex consequences are there. If you are continuing going for using the laxatives and you are continuously going for vomiting, you are continuously going for starving yourself, as in anorexia, what should happen? Your body will lack in the electrolyte balances, and that then leads to irregular heartbeats, and it can lead to death also if not treated on time. Electrolyte imbalance is caused by dehydration and loss of potassium and sodium from the body as a result of purging behavior. When someone is having a continuous purging behavior for more than 3 months, definitely it will going to be affect our digestive system, our hydration level. That can cause dehydration, that can cause excessive loss of potassium and sodium from our body, and that can lead to severe health problems also. Inflammation and possible rupture of esophagus from frequent vomiting. That is also a result that can happen after that purging behavior. It can lead to rupture in esophagus because of that frequent vomiting, and sometimes ulcers are also there. Tooth decay and staining from stomach acids. As frequent vomiting also comes up, carrying some of the that gastric juices from the esophagus, so it can lead to tooth decay because as a consequences of frequent vomiting. Then chronic irregular bowel movements and constipation as a result of laxative use. When someone is laxative abuse, that means they are taking the laxative without prescription and for a long duration. What will happen? They will be have irregular bowel movements, and that can lead to diarrhea as well as constipation also. Abnormally slow heart rate and low blood pressure, which means that the heart muscles are changing. The risk of heart failure rises as a heart rate and blood pressure level sinks lower and lower. Uh, that is also a consequence that when someone is regularly going for the purging practices, that will be leads to long-term ill effects on the health of that particular patient also. That abnormality will lead to, in the starting they will be see the lower side of blood pressure, they're having a low heart rate, but definitely when even at that time also they will be not get the treatment and they will not treat it well, that can lead to major cardiac problems and to death also. Then the second thing is reduction of bone density or osteoporosis. They can have reduction of bone density because their body is not getting proper nutrients, which results in dry or brittle bones, muscular loss, and weakness. It can lead to severe dehydration, and that severe dehydration can be results in kidney diseases and can lead to kidney failure, fainting, fatigue, and overall weakness in such type of patients. Then dry hair and skin hair loss that we discussed during anorexia also, that is also common in bulimia. Growth of a downy layer of hairs called lanigo all over the body. Yes, that is also the new sign and symptoms that we have. There is a need to be discussed it on. What happened when your body is not getting the proper metabolism? You're not getting the proper food. Due to that, you are having slow metabolism, or your body is not having that proper heat, which will be desired to keep your body warm. So your body will act in a passive manner, and there is a growth of lanugo, the small hairs on your body. Why your body is responding in that manner? Because to keep the body warm. That is also a consequence. I have seen the number of patients who are, especially the females, who are having these lanugos on their face and their entire body. And hirsutism, we can say in the another terms, and that is most probably on the face and in the lower cheeks, that area, these are having in efforts to keep the body warm. In addition to face, they are having the lanugo on their another body parts also. Okay, why the eating disorders are most common in adulthood? That question might have to be come in your mind, because from the starting we are discussing by co-associating it with the adults, because that is the age when you leave your home for college. You settled up in the another cities. You settled up in the hostels. You are having sometimes termination of intimate relationships, that is also causing a stress on you. Some family problems must be there. Sometimes one can be physically abused or sexually abused, so as a consequences they will be focused on such type of things. Sometimes what happen when someone is overweight, so usually they can have to be face some comments from society, even though their family members are also having such type of behavior with them, they will be tease them. So that type of abuse behavior with them also leading them, they will know such type of practices will leads to consequence of physically health issues in me. But in spite of the knowing, because they don't want to be get teased up in the society, what they choose, they will be opt for quick weight loss, and for quick weight loss they will be go for such practices. So these are the major stressors which can provoke the adults to adopt such type of malpractices, and that can be worked as a stressors for them to adopt the malpractices. The certain factors I have kept here in response to interpersonal, social, and environmental factors. I have categorized there that provokes the adults to adopt the malpractices that leads to eating disorders. So these are the certain factors. For example, if someone is not having proper family and personal relationship, when someone is lacking behind in that area, so they will be having the extra concerns on their body, and they will be go for such type of practices. Difficulty in expressing emotions and feelings. These are the interpersonal factors that can lead to such type of practices. Then history of being teased. As I told you that someone can be teased by family or by society, on roadside or in the family functions or in the social gatherings. So being as a citizen, we won't have to be teased anyone because of their weight. And usually I have seen the number of incidences when we are even though in a humor also, कभी कभी मजाक में भी हम लोग ऐसा बोल देते हैं, you are gaining the weight, or you are having so much thin body, you are not eating the food properly, or this should not be happen, because ultimately that can lead to anxiety in that person, and then person or that patient will go for the unusual means of losing the weight or gaining the weight. Then if someone is having the history of trauma, if someone is having the history of sexual, physical, or mental abuse, 60 to 75% of all bulimia nervosa patients have a history of physical or sexual abuse. See the data here. है because of our that small jokes and small teasing, what happened? These will leads to bulimia nervosa in the patients, and they can opt for these practices because they don't want to be get teased off. The researches have been shown that 60 to 75% of the patients who are having bulimia nervosa in their in their whole life, they will be teased by the physical or sexual abuse. Then there are some of the environmental factors also. These are the environmental factors which leads to adopting of the malpractices in the adults. Social factors. The most important role is played by media in that. When we are watching the TV, when we are on a social media, we will see the number of advertisements are there, the number of projections are there, which are showing this type of things to attract these adults for having the perfect body shape or for having a perfect body nature. Cultural pressures that glorify thinness. Yes, in our cultures also, we will take the thinness as a beauty regime, which is not true. And place value, obtain the perfect body. Narrow definitions of beauty that includes only women and men of specific body weights and shape. As I told you in starting also, for being as a supermodel, we must have that much height and that much weight. So that is not true. We cannot define the beauty in terms of weight. Cultural norms that value people on the basis of physical appearance and not inner qualities and strengths. That is also the one amongst environmental factors that people are facing off. Appearance are not inner qualities and strengths. People pursuing professional or activities that emphasize thinness or more susceptible. For example, for air hostess, we will need to have a perfect body shape, body weight along with the height. Or for in marketing also, and there are the number of professionals in which we are supposed to be have that much body equation, proper body equation. We must need it. So that is also, I can say, triggering out our adults to go for such type of practices, and they can be the patients of these eating disorders. For example, modeling, dancing, gymnastics, wrestling, long distance, running. These are some of the examples that can lead to such type of practices. Some basic facts. Now, I want to discuss some basic facts and some research results which are showing the consequences and ill effects of eating disorders. Media, as I told you, that media is influencing our lives so much. We cannot say just influencing. About 80% of the things are nowadays operated by the medias. According to the recent survey on adolescent girls, the media is the main source of information about women's health issues. The researchers have been shown that estimated 60% of middle school girls, they will be at least once read the fashion magazine regularly. Another study of mass media magazine discovered that women magazines had 10 to 10.5 times more advertisement and articles that are promoting weight loss than man magazines. If we are comparing why females are more prone, if we are comparing that fact, so that is also a cause. That fashion magazines and then female media magazines, the majority of the portion of coverage of the advertisement is regarding the weight loss and beauty, for making them fair or for having the perfect shape. So that also contributes and that also diverts the minds of the youth to adopt such type of practices. The study of one teen adolescent magazine over the course of 20 years found that the article about fitness or exercise trends 74% cited to become more attractive as a reason to start exercising 51. There is a survey regarding the adolescent magazine that the articles which are focusing on exercise plans, they are cited less in comparison to the articles those are focusing on active weight loss. Because everyone wants the easy way. If you are having an easy way to lose the weight, you will not go for the exercises and nutritious diet and well diet plans. The average young adult watches 2 to 4 hours of TV per day, and the study shows that 4,294 network television commercials reveals that one out of every 3.8 commercials sends some attractive messages. If we talk regarding these commercials on television also, then one amongst approximately 1 out of 4 One out of four commercial is again that is leading to some messages on attractive body and some messages on being the weight loss or being looking beautiful. So these are the some facts regarding the media, how media is diverting our youth towards such type of practices to have the beauty regime. Media messages help to create the context within which people learn to place values on the size and shape of the body, as we discussed earlier also. Advertising and celebrity spotlights. That is also a fact that in advertisements, they are taking such celebrities which screens to be thin, they are projected very thin, and definitely they are looking beautiful and good. Media has high power over the development of self-esteem. So this is how the media is impacting us. So till now, what we have discussed regarding what is eating disorders, few of the data and strategies of statistics of eating disorders. Then we have discussed two most prominent eating disorders in the adults, that is anorexia nervosa and bulimia nervosa, and how that vicious cycle of bulimia nervosa is going on. What warning signs, being as a counselor, we have to be go for, and how media is diverting our youth towards such practices. Now the thing comes is the treatment strategies. Till now, we have discussed, yes, eating disorders are very adversely affecting us, both in physical as well as mental ways. They're leading to various physical problems as well as mental illnesses also in the adults. So, how we can treat them? The treatment is not so complex. But the thing is, we have to be stick on the regimen. We have to be follow up the treatment. We have to be take the complete treatment, and most probably the treatment is of long duration in most of the cases. These are the treatment strategies. Daily treatment addresses physical and psychological aspects of eating disorders. We have to be kept in mind. We have to be kept in mind in both the ways. We have to be looking for the physical addresses, and as well as we have to be go for the psychological aspects that we have to be covered up while treating our patients of eating disorders. People with eating disorders often do not recognize or admit that they are ill. As I told you in starting of my lecture, that they're not taking themselves as an ill. So if they're not taking themselves as an ill, they will not accept the treatment. They strongly resist the treatment. And as the treatment will be long-term treatment, so one of the basic responsibility that we are having is to make them patients. We have to be make them these patients to be follow up the treatment regimen. We have to be strongly. What can I say? We have to be strongly say them to be stick on the regimen and to follow on the diets and another practices that will be given by the adverse effects. Then, depending upon the severity, eating disorders are depending upon the severity. We have to be treat them. If it is a mild, then the treatment can be in an outpatient setting. We can have individual, family, and group therapies. And if that is moderate or severe, so in some of the cases, the hospitalization also required. Medical treatment, as I told you, that can lead to some of the psychological issues also, that can lead to depression, that can lead to a number of anxiety issues, that can lead to fear, phobia. So what we can to have, we have to be use the medication for such things also. We can have to be go for existing with the eating disorders, treatment of depression and anxiety, because it leads to hormonal imbalances in the body also. So we have to be go for the hormonal therapy, and for the increasing of bone density, we have to be take the extra diet which is having the extra amounts of calcium as well as vitamin D, as well as we can go for the artificial resources of vitamin D and calcium also. We have to be encourage the weight gain in the patients. We have to be induce the hunger. We have to be serve the food in very attractive way. Then we have to be normalize their thinking process. That is most necessary. Until unless we will normalize their thinking process, they will not accept the fact and they will not go for the treatment. The drugs may be used with other forms of therapies. For example, we can opt out for the antidepressants. We can go for hormonal pills. We can go for some calcium supplements, and that will be very helpful in stabilizing the weight recovery in the patients. Now we will go for the psychological treatments that we can give. We can go for individual therapy, one-to-one counseling, or that is IPT. It allows a trusting relationship in between of a patient and the counselor. And several different approaches can be used for the individual therapy. We can go for cognitive behavioral therapy, CBT, that is focusing on personal thought processes. Here we have to be working by keeping a view of personal thought practices with the patients, and we have to be interact with them. We have to be make them focused on their health. We can go for interpersonal therapies, that is maintaining